following New York, Texas, California, Florida, and New Jersey. Now, we don't really hear much from Texas. Governor Greg Abbott doesn't really speak out that much. We hear quite a bit from, obviously, Governor Cuomo, from Governor Newsom. Sometimes DeSantis comes out, and we hear from Phil Murphy, the governor of New Jersey, almost every single day, but not a lot from Greg Abbott. So I want to play out a couple stories for you from our sister station, Fox 4 Dallas, just about what the latest is for COVID-19 news in Dallas, and then also what vaccine distribution is going to look like. A lot of those ICUs are already prepping for it to be hitting their shelves pretty soon here. So I'm going to play that out for you here on News Now from Fox. Some of you are going to be going to a 2-minute commercial break, but when you come back, more COVID-19 news coming out of Texas.
New COVID-19 cases and 30 additional deaths reported in Dallas County Thursday. 30 COVID deaths is the fourth highest daily count total the county's seen during the pandemic. The second highest was 33 on Wednesday. Still, experts believe the worst might be around the corner.
The take-home message is we've not even seen the Thanksgiving effect.
Dr. Mark Casanova, president of the Dallas County Medical Society, says while the high number of positive tests we're seeing likely reflects Thanksgiving gatherings, the deaths likely do not, because it typically takes about a month before people die from COVID-19.
We've all read stories of individuals who passed away rather abruptly, oftentimes in their home. But deaths that result from COVID tend to occur after a prolonged illness, and in many situations, a prolonged hospitalization, oftentimes in the ICU, intensive care unit.
The Dallas County Medical Examiner's Office has been using a refrigerated truck to occasionally help store an overflow of bodies since summertime. The county says it's currently at capacity inside headquarters, and it's averaging roughly 15 additional bodies each day compared to times before the pandemic.
When you see an increase in case numbers, you see an increase in hospitalizations that follow that, then regrettably you can predict several weeks to as long as a month after those increased in hospitalizations, we'll start to see the increase in deaths.
Health experts believe we'll see an increase in coronavirus deaths related to Thanksgiving exposure around Christmas time, an uneasy reminder to folks who might be thinking about gathering in groups during December holidays. Their message:
while we're not trying to be the Grinch that stole Christmas, to really bear in mind that our decisions have consequences. If you got together with family and you got lucky for Thanksgiving and you skirted it, that doesn't mean the same will happen for Christmas. This really is playing Russian roulette with a deadly virus.
Vaccine introduction is an urgent need.
But is it safe enough and ready to roll out to millions of Americans? Makers Pfizer and German partner BioNTech believe it is. Today's FDA Advisory Committee, one of the final hurdles before the vaccine gets emergency use authorization, or EUA, meaning the FDA believes it's safe and effective, but the drug has not undergone the rigorous process of an FDA-approved drug.
We have been asked often, how can this be done in a year or less, when the process normally takes many years? Well, vaccine development or anything else in a pandemic setting is not normal.
Pfizer says it's been an unprecedented investment early in development. With collaboration from the FDA, it squeezed the timeline by collapsing several clinical phases. The FDA offering assurances studies will continue on those who get the 2-dose shot.
Understand that vaccine safety and effective monitoring is a top priority for the U.S. government, and we're committed to ensuring that all these systems are in place and ready to go as soon as the vaccine program is implemented.
Among the concerns, the lack of data in studies so far for those who fall in certain groups.
There's also limited data available on minority and underserved populations, as well as pediatric populations, pregnant women, and the elderly.
Others wanting assurances transparency will continue moving forward.
The EUA fact sheet prepared for the public must be transparent and fully disclose known and unknown risks.
The FDA says EUA for the Pfizer vaccine does not preclude other makers from seeking the same authorization and rolling out their products. In the meantime, focus on what happens after people across the globe roll up their sleeves, making sure any adverse effects are closely monitored. On Tuesday, 2 people in the UK suffered allergic reactions after being injected with the Pfizer vaccine there, leading to new warnings for certain groups. The FDA vowing to work with the WHO and other international partners.
We are working directly with collaborators in the UK and in Canada to make sure that we're sharing information as quickly as possible.
So that was the very latest